We're just going to dive right in. And a bit of a dry run on the first time for anybody that's just joining us. We did have, I mean, how many names we got? Matt Ward, Dr. Matt Ward, Wardo. I mean, I'm sure there's some other loving terms of endearment that your friends would call you on a night full of whiskey. But he joined me. We had some technical difficulties. I almost office spaced my MacBook as it did the spinning rainbow wheel of death, but we're back and we're going to dive in. And now I know what to ask this dude even a little bit better than I did before. So to start off, and I think the most apropos title of the podcast last time would have been Jack of all trades, because it's kind of the theme of your life. So why'd you do all this stuff? I mean, there's all this stuff, man. So kind of tell me, I know that you got into, well, no, I don't really know. You told me in your bio that I'll read at the beginning of the show, you got into chiropractic because of some injuries, some CrossFit, but why conservative musculoskeletal care? You could have done a lot of stuff. Could have been orthopedic surgeon, could have been massage therapist. It could have been why that?
Yeah. Well, I probably couldn't have been a massage therapist because I don't like spending that amount of time with anybody. But
even your friends.
If you're an orthopedic surgeon, they're under GA, so it's not too bad.
Yeah.
No, I'm kidding. No, it was this weird thing, man. I never leaving high school. I never thought I'd go back to school a day in my life, and then I went back to school for 8 years. So shit happens. I was in the strength and conditioning training realm, and I seemed to slowly slide my way out of performance coaching, and I pigeonholed myself in kind of like rehab training. And I started to get a bunch of patients from chiropractors and physios, and I started to spend more of my time was spent kind of like designing a program for somebody with flexion, what I now know is flexion intolerant low back pain, a poor hip hinge, poor dorsiflexion of their ankle. And that's kind of where I sat with CrossFit coaching, like head CrossFit coach at Studio 55 in my later days before chiro school. And then with my company, Primal Performance, just doing rehab. And I was like, man, I am fixing, and this is going to maybe sound a little egotistical, but I'm fixing people's problems of 15 years that no physio or chiropractor has, because I have this ability to kind of linear progress this strength training paradigm, activity modification, change their running gait, whatever it might be, in a way. And I have 15 different ways, probably 100 different ways to teach the same thing. And I'm willing to spend the time and beat my head against the brick wall time and time again because I'm stubborn, and then it gets results. And I was kind of sitting there like, this is bullshit. Like, I'm getting paid as the lowest member on the totem pole, and I really enjoy this. I think I'm going to go back to school. And then it was just trying to figure out if I was going to be a physio or a chiro. And honestly, I was working with a few other physios, and nothing against them, but I was doing a lot of the same stuff already. And when I looked at the chiropractic curriculum, it was a lot of stuff that I did not know. Mm-hmm. And as far as the differential diagnoses, and that was it. And so I hopped on that train, and then went to University of Western States. And then obviously, that's where, I kind of met through that and all that stuff. But the interesting part about my background leading up to that, logging, driving a logging truck, running a saw, forest firefighting, owning a gutter company, working, building framing, working for a trust company, X, Y, and Z, retail. I have a low level knowledge of a lot of crap that a lot of people do. And it helps me relate to them in the treatment room on all different levels. Because I think in the treatment room, you truly need to be a chameleon. And, if you can fit in with that person a little bit and get them to buy into what you're like, as you're selling basically the same stuff to everyone, mm-hmm. which is just to help them, right? It's mobility, it's stability, it's how to change their life for the better. But you just have to approach it in a way that fits their lifestyle and their ear versus the other maybe 10 people they've seen who've told them they can't do X, Y, and Z or whatever. So that's kind of it.
There's a couple interesting things there. The last part that you said of really it's how you're communicating the same things that are done is maybe the differentiator, which I just think is interesting. But I'll back up to, I mean, you correct me if I'm wrong. It sounds like really your main driver of going to school wasn't necessarily, you mentioned like filling in the gaps of knowledge, like the chiropractic curriculum was, varied from what you did, which has kind of been a theme of your whole education career from that point on. But it seemed like kind of the business money side was the driver. You're like, well, why am I getting paid at this threshold when I'm doing this work, which is very interesting. And I just want to hear your thoughts on this. There's a lot of kids that are going to, I always say kids, I should say students, because they're probably, not that much younger than me, but whatever. Maybe they are getting there.
Have you met these kids, man? They're kids.
Yeah, true. Yeah. Well, yeah. Recorrection.
Yeah.
But that think that they shouldn't be going to school once they get in there because they're like, what the hell? I'm just doing basic strength and conditioning principles, fundamental movements. Some of them kind of start to believe that they could be completely hands off and still get the same results. So it's almost like they're flipping the paradigm that sent you in. Like, where do you stand on that?
Yeah, man, that's a great one. So obviously, like being in Canada, different healthcare than the United States, and I can't quite speak to how it would work. So as a kinesiologist in British Columbia, you don't make any, there's no extended healthcare benefits that you could make. So there's like some stuff with like ICBC, which is our we have a monopoly of car insurance. Don't get me started about that. And you can make $80, $82 in an hour is what you can make doing that. So like, $80 an hour, college degree, not bad. I was charging $100 an hour downtown Vancouver, personal training sessions. And, spending an hour with somebody. And when somebody comes to see you with some flexion intolerant low back pain, and you teach them the hip hinge, you do a little assessment, teach them the hip hinge, 25 minutes later, they're like, yeah, like my back doesn't hurt anymore. You're like, huh. They're like, well, what else do you want to do for the rest of the session? And because, you're still, a kinesiologist is really just a glorified personal trainer. Mm-hmm. You are now like I would get this like, hey, are we going to like sweat a little today? It's like, man, I just took care of your back pain that you've had for 14 years. And you still are like, well, when are we going to like, get on the treadmill and get a little sweaty? And I just was like, whoa, this is a challenge. So, and I just didn't want to spend like an hour with people anymore. And it was hard to justify the 30 minutes. I was looking at opening up my own brick and mortar place as a kinesiologist. Mm-hmm. And there are other guys who've done it. There's one other guy in the Lower Mainland who I know. I can't remember the name off the top of my head. It's been a while. Rob something. Anyways, he had kinesiologist and he had physios and chiros kind of working in his shop, and he's a pretty switched on dude. And like I'm telling you, man, like he was making that passive income off those guys. But as far as like being able to like, if all of his guys were like, we're leaving, I'm telling you, like he was in deep shit with loss of that place. And I just didn't like that feeling. Plus it's just this constant battle uphill of like, you're out. We churn out probably like 1,000 plus kinesiologists a year in British Columbia as from university, maybe more than that even. And it's like, where do they all go? And they all literally go into, it's almost the same as a psychology degree now, like a psychology arts degree, that you're like a really educated personal trainer on the body, but with zero practical knowledge on how to design anything. So you kind of are like in this weird kind of continuum where you either start working at a Globo gym, or you get the opportunity to go work in a clinic for somebody and learn from maybe somebody like myself. And I learned from somebody in the past. And then
in the States, if you get a kinesiology undergrad, it's kind of like I'm not going to say it's a non-degree, but it's like, okay, what are you doing next? Like it's a step to a graduate degree, because there's not in the States, there's no jobs that exist for that. You're going to go get a certification, do something else with that
Yes.
undergrad degree, or you may not even work in the, exercise physiology fitness world. You just kind of go do
Yeah.
something else. So
Yeah.
it's really
Yeah.
common.
So that essentially that was the writing on the wall. And it wasn't so much the money, but it was like, man, if I'm fixing this stuff, I want to have the opportunity to, obviously I'm looking at the timeline, looking out and what I
Hmm.
want to achieve with my life. And a lot of that stuff, you need to make money at some point.
Yeah.
And I felt like I loved what I was doing. I felt I was good at it. And I thought, the rationale was there. I'm certainly not, running the maximized living chiropractic plan, but
Missing out, bud.
missing out big bucks, big bucks. Turns out I'm just doing the same old shit except on 20-minute
Well,
visits.
well, that was my question though. Has it transformed the way you thought it would prior to going to school?
The financial thing.
Yeah, just what you pictured it to be after school versus what you were doing before you went.
Yeah, to be honest, man, I joke about this all the time with my buddy Corey. I feel like extremely fortunate to make the kind of money that I make doing this job the way I do it. Could I make a lot more money if I was a greasy kind of rack and crack chiropractor? 100% I could. But at a certain point, I don't think you need to make any more money from where I'm at right now, especially
Mhm.
with the clinic that we have and the passive income that I'll start to be making as a part owner. Like I can still keep my integrity, and I never needed to make $1 million a year. I can try and let my money work for me as I grow up, and so on and so forth. I think I was just if you can make 6 figures a year, and then especially if you have a dual income down the line, I mean, like there's not a lot you can't do in this world. Maybe you're not going to live, the
Mhm.
Richard Branson lifestyle, but I think keeping my integrity and my ethics kind of close to the center of what I do is extremely important to me, and I feel like this job allows me to do that. And I hear it day in day out when I'm getting people coming in who are like, man, yeah, this guy took x-rays the first time and then I wasn't treated till the fourth visit. My review of findings was with 14 other people. I'm just like, yeah, I'm still fighting the good fight. I make
Mhm.
less money than that person, but they run out of people at a certain point in time.
But I think that's a really good point for especially students that are listening in to hear that, I tell our new doctors in here that are, they're contractors in here. So it's kind of their own business. And I always say you get to use the brand of the farm that's established, but you're still your own thing. Like you can do what you want. You're responsible for a lot of your own stuff, but we have a lot of people coming in because of the farm. But if you want to practice the way we do, you're never going to be wealthy working for money, right? You got to let your money work for you. But at the same time, what we do probably isn't going to drive enough income to even get to that point. So you kind of have to start thinking like, what are my other passive income sources? What other things can I do? They may be out of the realm, but they may be within the same realm, right? There's people that we know that make twice as much teaching as they do treating, right? And like things like that, there's avenues to create income all over the place. But I think it's false advertising to think you're going to get out of school practicing the way we practice and make over 100,000, especially the first year or two, and just be like, dude, this is awesome. Like it's just not going to happen. Like it's a
This is
different
great.
practice style, but you have
No.
to become a business owner. You have to, create those revenue streams. So I love that you tapped in on that. So talking about the filling in of knowledge gaps, I mean, maybe there's a main theme or maybe there's a few things. What were some of the biggest things that you did pick up through school, right? Thematically or, principles or whatever that did change what you do in the treatment room versus what you did in the gym?
Yeah, it was that's a good one. So I think it just changed the lens in which I look at a patient. Obviously getting in, and I think that what we learn at chiropractic school is extremely good. I think the education I got at University of Western States was very, very good. Feel very confident with a lot of my like red flag differential diagnosis
Mhm.
stuff when somebody comes in, and I think that's extremely important because like missing some of that stuff can literally lead to death. So I feel very confident with all that. I think the lens in which mm, the lens at which I view a patient, and now which the hierarchy of things that I see, like being able to go through and learn about the nervous system and then go through Shacklock stuff because I'm a chiropractor, the access to the courses that I was able to take kind of through R2P, to be honest, like getting introduced to a lot of that stuff. That's how I now view kind of that's how I view a patient. So I kind of have this hierarchy of like kind of nerve, disc, and then the whole time as they're moving, you're looking at the movement mechanics, you're starting to figure out the weak spots, figure out the stiff spots, so on and so forth. And then I kind of used to, as I first started out, be like, all right, like I'm just gonna treat this one thing and then go to here and then treat this next thing and then go to here. Like if directional preference doesn't work, I'm just going to keep doing it. But now I've kind of changed that completely. Whereas like, if I'm not getting results instantaneously, like I basically just revert to the strength and conditioning principles that I knew before and get them doing something, creating some stability in some other spots. And ultimately they end up getting, at least they're getting something out of it and getting moving a little bit, before I kind of beat them over the head with like, oh, what do you mean these 50 press ups didn't work in the clinic? You know what we should try? 100. They're just like,
Didn't do enough. Yeah.
Yeah, my triceps are sore, and my back actually feels considerably worse. I'm like, well, we're pulling the pain out of your leg into the centralization. They're like, I didn't have any pain in my leg. I'm like, right, yeah. So
Sometimes I feel like I'm going to have a patient come back in like Timmy off of South Park. Like their arms are just completely jacked and they're still having neurologic radiculopathy and their legs like atrophying. And they're like, it's not any better. And I'm like, did you do them 7-8 times a day? And they're like, yeah. I'm like, oh, okay. But yeah, so what I'm hearing there is your starting point changed,
yeah,
right? The strength conditioning obviously was your only tipping point or jump off point before. Now that tends to be second, right? And maybe not all the time, but like you said, different lens, different starting point.
Just confident with many different aspects to kind of view a patient through.
Yeah.
And I think the other fun thing is that like I just really don't care what you do. Like I have NHL hockey players, I have people who are 70 years old, I have kids who are 13, I have and everything in between. And I just don't really care like what you do. I'm like, this is where you're weak, this is where you got to work on it, and that's where it is. Or this is what isn't working well, and we got to fix that. And I think a lot of people get that from me, and that's what they appreciate, especially when I talk to like the S&C coach that's working with the athlete that I'm working with, or whatever that might be.
Well, and the flip side of that can be a trap. People, oh, we do this for hockey players, we do this for baseball players.
Yeah.
Like, I think that's a huge trap, because I'm going to pull from the podcast we did before. You mentioned that really, you learned all these concepts and you did all this continuing education, but it really got you to the point where you're like, oh, it's kind of about the fundamentals and principles of can you do X, Y, Z? Do we rule things out in this like, systematic fashion? And then it's like a lot easier than you think it should be, which again, speaking to the students, I think should give them reprieve or relief, I guess, that it's like, when you get to a point, you kind of realize like, oh, it's not this like thousands of things that I need to like do and like thousands of things going on, like be smart, be systematic. And all of a sudden it's like, man, it's fundamentals. Like I'm doing the same stuff with the 13-year-old that I'm doing with the 78-year-old or the pro athlete,
Yeah, it's wild. And I think back to that as like a kinesiologist before as a chiropractor. I was a chiropractor. Like that's all I was doing with anybody. It's just like, can you like some of McGill's stuff, like, can you hold a side plank for like even 60 seconds and you want to deadlift 450 pounds? Like you can't. Like there's a weak spot in the chain here. And I don't care who you are. Like I remember working with this kid who was MLB. He was drafted. He does play in the MLB now. And I just remember doing his basically his like posterior chain endurance test, and just kind of like sat on his legs. And I think he held it for like 4 seconds before he was like, my back is spasming. And I'm like, he's a big, big boy. And I was just like, man, like you have nothing. And then what I
Mm-hmm.
know now is, and how I view that now is not that his posterior chain was weak, but his like anterior chain was so underdeveloped, and like that lower abdominal strength, there's just nothing. He had like a
Mm-hmm.
6-pack above his belly button, and
Yeah.
then like a low gut. And it was just like, yeah, you got to fire. And I didn't know what to do with that back then. But definitely now, I feel like that's honestly like the basis of all low back pain. To be honest, it's getting like a bit silly with no
Well,
matter who
this
comes
gets
in.
a bit off topic, but I had a huge aha moment. I'm sure other people have had it. So I'm reading Dan Lieberman's new book, Exercised, which everybody should read. Awesome book. He's a great author to begin with. But it was talking about the difference between like a chimpanzee's lumbar spine and a human's. And obviously our lordotic curve allows us to stay out of this like forward torso lean that offloads lumbar erectors so we can walk and run. And like you said, the genesis of a lot of low back pain is what people only dominate with, which we talk about this all the time, upper rectus, you could call it lower cross syndrome, whatever. And I was like,
Yep.
well, holy shit. Here, Dan Lieberman's just talking about the anthropological like record of why. And I was like, really good point. So maybe we start calling it chimp back.
Chip back. We
Yeah.
could have that.
Yeah.
This could be in talk about revenue streams.
One of the other things I wanted to kind of dive in on this, saying, that you boil all this like high level stuff down, right? You started as an S&C coach, you went to grad school, you've done all this continuing ed, you see all the variety of people, athletes, active people. Are there any common themes? And this may not just be musculoskeletal injury. What are common themes that you see are lacking or that people misunderstand that are drivers for like getting them into your office? Right.
Yeah,
Obviously getting hurt in athletics, I think that's a given, but like outside of that, like what do you think is the biggest detriment to people's like health overall right now that you're seeing?
I think I see. So if people are injured and like you end up, I have, even in the clinic that I'm at, like I have these like Dr. Matt patients that come in, which are, they've seen a lot of people, and there's they talk on the phone for quite a while before they come in to the front desk. Like they're pretty amped up. They usually have a book of imaging. Not everyone, but they've got like
Oh yeah.
it's a typical type. And I think what fails them the most is that they've seen many people. A lot of people have written them off, and that there's like, it's top down, like this person needs to be on some sort of antidepressant or SSRI. And I think they just haven't been given a plan. I think they haven't been allowed to move in a certain way. Or they come in to see me and they're like, yeah, like X, this is rubbed and this has been cracked, and I've been to the pain clinic for these 50,000 injections. And I'm just like, hey, has anybody ever like taught you to hip hinge and given you a couple of bird dogs done properly? And like, they're like, no, they said that stuff's bad for my back or whatever. And I'm just like, what? Or like, I've got this knee pain that I've had for 15 years, and it sounds like garbage in my knee. And like, they're probably going to get a knee replacement without a doubt.
Mm-hmm.
But what do we need before we have any surgery? You need to make that area, I don't give a shit if it hurts. You need to
Yep.
make that area as strong as possible. That's going to give you the best chance of recovery, getting that range of motion back, recovering your life. And I just think there's a lack of like a long-term plan. It's
Yeah.
just kind of like we'll come into a clinic and they're just like, yep, get it rubbed, like adjust the ankle, out you go, tape the knee. Cool. Yep. See you in 2 weeks. Yep. See you in 4 weeks. There's not this, and if you're doing, and some people start out like, yeah, cool. Like here you're like wall sits, but they're like for 5 seconds because like, oh, my knee hurts. I'm like, do it for 60 seconds. Like, I don't care if you piss yourself. Like you need to strengthen. If you can go down the stairs, I guarantee you can hold a wall sit for a little while. So I think I just really try and give people the confidence. And I think that's where a lot of people are lacking right now in coming out is giving people the self-efficacy and the empowerment to control whatever ailment that they have.
Mm.
I think that's a big, big, big problem.
Yeah, because I
Yeah.
would say people are inundated with what's going on with them, obviously
Yeah.
from self-research, what they're told. You said the book of imaging. So this may be a bit cliche, but like, what do you think you're like, if you had to put your specialty on a business card, right? Because obviously you're a chiropractor, you see mainly
Yeah.
athletes, you do rehab. Like, what's your specialty though? It's not those things. Like, what do you think sets you apart from other people in your field or just within your patients? Like, would you say?
Communication, without a doubt. Yeah. Like I will beat you over the head with positivity about what else is going well and what other ranges of motion are great when you've been in, pain for X amount of years. But it's like when you have excellent T-spine rotation, I'm like, wow, that's excellent. Like, do you play golf? Like, you should play golf because that's excellent T-spine rotation. Your hip moves excellent. That's great. Your ankle dorsiflexion is awesome. Wow, your hamstrings are weak as shit. We should probably work on that. So on and so forth. Like, and then I'm allowed. I just get to a very real level. I think my communication with patients, I get that more often than not, that they're like, yeah, like I leave the office and I like feel good. I understand what my problem is, but hey, I also have all these like good areas that like I thought maybe my whole body was completely useless and I was going to have to be like taken out back like old Yeller. So
You're like, we have
I,
that
I,
spot too, that we just don't talk about
yeah,
it.
that's actually next time when I tell you to meet me up in East Kelowna behind the dump. That's
Hey,
where it
you
is.
want to go hunting? Yeah.
Yeah,
Um,
exactly. I think that's
it,
probably my biggest strong
you
suit.
you probably saw me kind of giggling when I don't know if I've ever referred to myself giggling, at least not for a long time, but I was definitely
You're,
giggling.
you're, you're a dad now, bro.
Yeah.
It's okay.
I had he's actually the head of infectious disease at UAB University right here, and we're treating him for some shoulder neck stuff, and I'm checking CT junction. He's been in a couple times. We have good rapport. And I was like, he's like, why do you think it's still going on? I was like, because you don't, this is not what I said, but you move like shit here. I said, there's an apparent lack of motion through your CT junction. He goes, I wish you would reframe it as suboptimal. And he was joking, but he was absolutely spot on, right? Like how we say stuff. And he knew, I mean, he's extremely smart, but like you
Yeah.
brought up an awesome point about, you know, people are usually coming into our offices, not the first person that they've seen. So they've probably been told some shit, maybe not in the best bedside manner, focused on the negative stuff. Like, I love that, man, that you're like, hey, this stuff's awesome. And you may need some of that stuff in your plan, right? If you're working with stenotic patient, T-spine rotation's key. Hey, you got it? Cool. We don't have to work on that stuff. So I love that, man.
Yeah. I
Um,
think that's a good one, man. I think it's such an easy one to do to make somebody feel good who's already maybe not feeling great about themselves. They've kind of started, because I get a lot of people who kind of started a weight loss fitness journey. Pain has stopped them. They've
yeah.
gained more weight and they're kind of in this like kind of endless loop of crap. And to get them feeling positive about themselves is extremely important. Gets them to buy into wanting to
Mm-hmm.
do the one or two things that I need them to do every morning and a couple times throughout the day.
Well, and I mean, yeah, your communication skills are awesome, but we talked about this again on the first time we had this little rodeo, but how much of what you do outside of work do you feel like bleeds into the clinic as an example for people, right?
Yeah.
Like, it's not like you want to sit there and be like, hey, I went and did a 50K this weekend, but it's like you doing those things. How much does that help you communicate with people? How much does it help lead from the front? Like, where do you see how that fits into your clinical side, all those things that you do outside of the clinic?
Yeah, well, I think it shapes who I am. And, like not only like you're one of the people that I look up to the most in that regard. You not only talk the talk, but you walk the walk. And I feel like I try and do the same. Um, and also with the varied aspects of my life, like, urban club over here, hunting group over here, ski group, mountain bike, golf, gym, fitness. You have all these different groups that are all kind of, a little bit of this and that, and then just general friends.
Mm-hmm.
You kind of get a smattering of a lot of different people, and it keeps me. I think that's just my personality, but it's also keeps me kind of not dogmatic on how I approach just one thing. Like I'm not just kind of a CrossFit bro, and I'm not just a redneck hunter. I'm multiple wheels and multiple avenues that turn. And I think that just keeps me very centered on who I am and what I like to do, and kind of keeps me very motivated on, on how I like to treat as well.
But I mean, I saw a research article not too long ago on runners that are injured don't replace lost running time with other stuff, right?
Yeah.
And that could be for a variety of reasons, but I think it's a lot of like people they like to run, not dog, not so do I, but they don't have the variety in their life of a movement, right? From our standpoint, but just like variety, like they don't have the option to go into the back country because of the lack of social circle or skills, or,
Yeah.
fear avoidance because they don't know. So I love that too, that you may open up through your communication skills via the things that you do outside, like opportunities for people that are missing, right? That
Yeah.
those meaningful tasks got robbed from them because of pain. It's like, dude, you could go do this. And hey, I know these people, or I've done that, whatever that is. But I also saw a research article on morbidity rates in physicians, and how it's like a 50% increase morbidity in physicians. We're talking like primary care orthopedists,
Yeah.
but these were also people that basically spent all their time working, right? That
Yeah.
like they may be the best what they do, but they don't have these other things. So that's not really health. So it's kind of like, if you're going to lead from the front and like you could be the world's best treater of symptoms, but you're not
Yeah.
necessarily a healthy person. I don't know if that's really what we need anymore, or these like outstanding clinicians. Yeah, in some realms, if my mom gets cancer, I don't
That's
necessarily want her to go to the guy that's the best like outdoor athlete and is kind of good at medicine, right? I
that's
want
right.
somebody pretty
Yeah.
good. But I think this gets back into the jack of all trades thing, that somebody's coming to you because they know your skill set is different than other people's. How do you, and this is just kind of, I want to know for my own, purposes, like how does you or your clinic, how do you guys get people to know that you're different? Obviously reputation, but let's say there's no reputation. Like what are you defining yourselves at? And I asked what your specialty is, but you're not going to definitely say, hey, guess what? I communicate really well. Come see
Yeah.
me. Like
Yeah.
yeah.
Fair enough. Yeah, man, I have spent most of my, I've been in Kelowna like 2.5 years now. I have spent most of that time, and and a good amount of money too, not on an ounce of marketing, but on a lot of experience,
Mm.
like just experiences, like doing different things, joining different clubs. None of them are like any business related stuff. It's stuff I like to do. And then it naturally, people at some point in time will ask me, oh, what do you do? I'm like, I'm like a chiropractor. And then, oh yeah, I got one of those. I'm like, oh yeah, cool. And that could be it. I really don't care. Like I want to golf. I don't give a shit about if you know what I do. But
Mm-hmm.
if you want to ask, that's what I do. And if you want to, and then when people, see me hit the ball like 340 yards off the tee, they're like, well, I'm going to go see that guy because then I'm going to do that. It's like, oh, you're
That was a humble brag, people. Humble
humble brag,
brag.
humble brag. You know what I mean? But it helps to be good at whatever activity you do.
It
Like,
does. And that's a complete sidebar. And I was going to ask you this. I'll just interject real quick. How much I'm going to tell you my little like ego thing that drives the shit out of me. And I told Sloan when we first used to go do trailers, like, I'm trying to win this thing. So people, I'm wearing a farm shirt. I get
yep,
done and people come over and talk to me. That's a driver for me. Obviously that's not available to everybody. I can't hit the ball 340
sure.
yards. Like that's just, I can't.
Yeah.
Like, so like, do you
Yeah.
think about that when you're doing these things? You know, you're not like, hey, I'm a chiropractor, but are you like, but I'm going to knock the shit out of this thing, or I'm going to maybe
I've
drink a whole
been,
bottle of bourbon at Bourbon Club.
that's right. That's exactly like I have been like that. I'm just so competitive. Like I've been that my whole
Yeah.
life. Like if I'm going to do anything, and this has kind of been in like the little hunting films that I've been in the last couple of years, like this is kind of the driver of it. They're like, whatever I do, I'm going to jump in, not with both feet, but I'm going to hit the bottom of the pool with my face. Like anything that I do, I'm going to do it 100%. And I think that comes across in that way. So to kind of backtrack onto your question, is I don't know what I would do if I didn't get reputation. Like I am all word of mouth. And our clinic, Valeo Health Clinic, has a good name in town. We're one of the biggest clinics in town. We have a quite a good name. We have a really fun squad right now. We've got 5 chiros that work for us, like 6 massage therapists, physio starting next in March 1st, and then a kinesiologist. You know, like we have like an awesome crew, and it's a lot of fun. And I think we all kind of get out there as kind of a new age, more active care type style clinic. And that comes across for sure. But I don't know. I personally don't take any call-ins that just kind of like, hey, I heard like Valeo Health Clinic, you know, I don't take any of those patients. I shuttle them to newer docs who are just filling their schedules, and I'm purely referral based.
Gotcha.
And that's the way it is. Like if somebody calls and asks for me, then they're coming to see me. But outside of that, that's it. So honestly, man, I can't really give a great answer to that question because I'm referral only. And people come in and say, they're like, oh, I hear you're like the guy who doesn't crack people, or hey, I hear you like, you know, you're different than others. And I've probably got 60% of my patients who think I'm a physio, for Christ's sakes.
Yeah.
Like, and I don't really care. I think when we can drop the letters behind the name and you're just like, my goal is to just be like, he helps people. That's it. And I don't care how I help people. I always tell people that. Too many times you have like, you know, the top of the board should be that patient. Lateral to that should be their goal. And all the modalities that we have at our disposal are far secondary. And if it's exercise that's going to help, then exercise is what it's going to be. If it's, you know, cracking somebody's back that's going to help, then that's what it's going to be. If it's cupping, if it's this, if it's education, that's what it's going to be. And if it's not in my scope, or if it's not something I do, you're gone. And people respect the hell out of that. I definitely get people who come in, they're like, no, it's just this, you got to do this thing with the, you know, the twisty thing. And I'm, you know, and then you fight that battle as it is. But at a certain point, when you get pretty full, you don't care anymore.
Well, and I think I agree big time with Brett Winchester. If somebody comes in and says, dude, I was helped in the past because somebody adjusted my CT, I want to be there. The competitive edge plays out in your favor, right? Well, I want to be the best at everything I do. And I think if we're going to be a chiropractor, you better know your shit when it comes to adjusting. And if I can blow them up, and I've had people that saw chiropractors, I'm sure you have, for years, they come in and they're like, well, that's never happened. Like when you adjust them, you're like, what the hell were you doing for a decade? You know what I mean? Like, and that's just that's a tool in our bag, not like the thing we hang our hat on. So I always think that's kind of funny when, you know, somebody, like you said, people come in and be like, oh, you know, I'm seeing my PT today. That's what they're telling their buddy. And I'm like, just don't tell the state board that, but yeah, it's funny enough. You said that you're going to dive into anything, you know, face hitting the bottom of the pool. How much does that compete with, because I know you go into stuff like this with that kind of novice mentality, right? Like we talked about in hunting, that like you haven't done a lot of this stuff and you're wanting to learn as much as you can, as fast as you can, which is diving in, but it's not going in with your kind of like ego raised or like, I have to be the best. It's like, I need to learn, right? Those are a little bit different. So like, again, maybe we can go into the hunting realm. Like, how do you approach that stuff when something's completely foreign or new, or you're trying to be the best? Like, what's your approach to that stuff?
I think I can't remember what year it was, but I listened to a Tim Ferriss podcast, and he said, you know, you are the average of the 5 people you hang out with the most. And I think that's actually very true. But it also can apply to certain realms. If you want to, you know, when I started snowboarding, when I was like 12, the person I went the most with had been doing it. How many was like 13? Anyways, he was really good and just like took me to the top of the mountain my first time. It's like, I don't really like slow down, or I'm not going to like pander to you on the shitty lifts. So hope you can figure it out. What do? You figure it out. So there's that. And then with hunting, I'm just like kind of fortunate enough. One of the reasons I moved here is my good friend Adam Yankee moves here, who's the owner of the Journal of Mountain Hunting. And with that came a lot of opportunity to learn from not only him, but now, one of the other employees of the Journal of Mountain Hunting, who's a sheep guide up north in BC, Nolan Osborne, Ben Storak, who's been a sheep guide in the Northwest Territories for 16 years, owns his own outfit that I went on a mule deer hunt with last year. Like these guys. So I've just surrounded myself in this bubble of guys who do this either professionally or have done it for 20 years. And I think that's the best way to learn. And I feel kind of the same with like chiropractic profession or any sort of healthcare profession is if you surround yourself with really good people and try and be the dumbest guy in the room, you're if you're the lowest common denominator out there, then you're probably going to be so far above the rest that like, you know, but then if you're also surrounding yourself with the smartest people in the room, and you're going to constantly have some humility, like when people are like, wow, man, like that's the best, like you're so good at this. You're like, in my mind, I'm just like, yeah, but like I got like four other guys who are far superior to me at this. You know what I mean? Like, so I think that's a big aspect of trying to stay humble with like whatever you're doing. Like the guys I try and golf with the most, like Brandon, he's going to play on the Mackenzie Tour this year.
Mm-hmm.
Like all these guys who just wipe the fucking floor with me on the golf course. And people are like, "You a good golfer?" I'm like, "Nah, not really." And they're like, and then they go play golf with me, and they're like, "That's bullshit." I'm like, "Yeah, the guys I golf with like haven't shot around above par on a recreational course for like 2 years, like so." It's just different, I think.
Well, I think that's a good, we hear that a lot, the people you surround yourself with, that close 5 to 6 people. And I think people a lot of times think that's friends, right? Which is true. Like that aggregate, you have a lot of time with them, but I like that subset of like mentorship within these groups. And if you're with the top 10 and you're number 11 or 15, that's still pretty damn good. And then you do that enough times, like, you matriculate up the cycle, but your goal should always be to kind of still stay in the top 10, like get with the
Yeah.
next top 10. But something that I think is kind of interesting is like, I remember the first time I played with like Mark Blackburn's a friend of mine here in Birmingham, and he was like, "Hey, you want to go play golf?" Here's a little self-tell. I hate playing with people that are way better at me than golf because I'm moderately good. I'm
Yeah.
not great. So I'll have really shitty shots and like stuff, and I'm so competitive. So I didn't know who we were playing with. It was 2 pro golfers, Mark Blackburn and me. And we go out, and again, I show up on the tee box. I'm like, "Are you fucking kidding me?" And,
Yeah.
luckily, some stuff was on, some stuff wasn't. But then so here's what I was going to draw from this. Here's 2 people that are playing on the PGA Tour, and they're giving me like kudos, like, "Dude, you freaking knocked the shit out of that one." And I'm like,
Yeah.
but I hit the last one like into the woods, like other fairway over. So like even the best in the world keep that humility and like give props to other people. I mean, yeah, you're gonna have subsets of people that are just dicks and nobody wants to
Totally.
hang out with, but we don't hang out with those people. So
Exactly.
when, let's say this, have you had the opportunity to be, because you're kind of a mentor to your patients, right? Teacher, whatever you want to call it, teacher, leader, coach, doctor, patient relationship, sure. Have you had the opportunity to mentor many students, right? Where you're now seeing they're coming to you as one of these people. And then like, is that something you want to do more of? Do you want to teach more? Do you want to, play that mentorship role more?
Yeah, man. I think one of the things I enjoy doing the most is teaching. Like with R2P, I went down and did a little integrated approach to the shoulder for the UWS students. And it's, I guess you can look at it that way, as like, hey, look how much I know. But it really, like, I come from the approach of like, this is what I've learned, this is what I'm using, this is what's been working. I still have a lot of gaps to fill, and as time goes on, I will, probably erase half the stuff that I even put on that presentation and fill it with other stuff or just erase it altogether. I enjoy teaching so much. Like I have this kind of a partnership with this gym up here. It's called the Women's Place, women's only gym. I love what they're doing there. The owner, Taylor Kolar, she is a big fan of kind of empowerment and strength for women. And they run like a barbell, they run a like kind of a new, it's called a strong program. And basically it's just like, it's barbell work, and it's teaching a deadlift, teaching a back squat, teaching a bench press. And the amount of varied bodies and ages that are in this, dude, I mean, if it's not the say what you will about CrossFit, but the trickle down effect has led to so many different people, maybe not going to CrossFit gyms, but being like, yeah, I kind of want to pick up something kind of heavy, like, what's that take? And so I've been able to, very, very fortunate, I've been able to go over there a lot and talk about bracing, talk about hip hinging, and have members come over. And then some of the staff, I chat with them all the time on, X, Y, and Z that I'm seeing, and then patient interaction. I feel like that scratches the itch right now enough for me, that just the communication with the strength coaches that I work with in town has been extremely fun to at least get that going. And then I used to think I wanted to kind of like really immerse myself and teach and, maybe create something my own, but maybe teach for somebody else or, something like that. And I'm not sure that's the case anymore. Kind of, again, I think you and I joked about this on the last one. As soon as I graduated chiropractic school, a few of my closest friends and oldest friends were like, yeah, but like, what else, how long this is going to last? What are you doing next? And I'm like, go to hell. But, I think if I really focused on it and I was spending my time traveling, teaching and treating in the clinic and all that stuff, because I wouldn't want to give up any clinic hours just for teaching, because I feel like that's where iron sharpens iron. Like as soon as I hear somebody who's spouting off about how to do something and they don't put asses in the seats and they don't treat, like, it's pretty easy to kind of philosophize over how to make somebody better and what everybody's doing wrong and why you could do it better. But if you're not actually doing that, like, I have no respect for you. If you've been doing it for 30 years and then you want to go say that, like, yep, okay, that's fine. But if you're a 4-year doc and then you're out and you're like, I'm just gonna like tell people what to do via this course, it's like, you don't know fucking anything. I'm not speaking about anybody specifically, of course, but
no, never.
Well,
what
I mean? I think that's it. So if I went out teaching, I would probably I'd have to retract some clinic hours to maintain all the other things I like to do in my life that make me and keep me happy and whole and sane. And I just can't see myself doing that. Like, I honestly love this job too much.
Yeah. Well, that's amazing. First of all, that you're in that, position, but I just finished up the Audible version of Gary Keller's The One Thing, which, that it can seem a bit like salesy. Gary Keller.
Yeah.
I remember I'm friends with our real estate agent. It works for Keller Williams, and they had somebody quit from their real estate practice because they said they thought it was a cult because it's so, defined with all these principles. And I was like, that's how you run a business, is having these processes. But it was just really funny. We had a good laugh about it. But he has a really good point in the book, The One Thing, which I highly recommend to anybody. It's a very easy listen to read, that he talks about finding mastery or chasing mastery in one realm allows you to do it easier in other realms. Tim Ferriss talks about this a lot, right? Like, so if you want to become a master at something, then you figure out the process, right? It's not like you have to spend, even though the 10,000 hour rule is a bunch of bullshit, you don't have to spend 10,000 hours on everything. It may be like, oh, I did this one thing and now I know I can take all those principles over here. So you kind of said, yeah, you love teaching, obviously you've got the clinic, you got, your outdoor recreation stuff, hunting. Like, what do you see your future looking like? Like, you've a jack of all trades. Everybody's asking what's next. We haven't really talked about some of the philanthropic stuff you want to get involved with, but like, what do you see yourself doing in 10 years? Do you think you're still in the clinic? Do you think what are you doing?
Yeah. I can't see myself smushing backs forever, but I can definitely, hopefully, in 10 years time, my money's working for me, passive income in the clinic, maybe a couple other clinics that we're talking about opening up, smaller shops that we own the commercial real estate. That's kind of the plan. And then, from there, we'll see. I just hopefully doing a lot of the same stuff I'm doing now, to be
Mm-hmm.
honest. You know, we'll see what that looks like. But I've kind of created this life now where I'm not looking, oh well, in 5 years I'm gonna start enjoying myself. Like I enjoy myself now. Like I
Mm-hmm.
could get hit by a bus. And I really do think that, like something could happen and I could get really sick, or all of a sudden a global pandemic shuts travel down, and so I try and enjoy now for now. But I think the biggest thing in the future is to just probably have the passive income sources that I would like, generating income for me, so I
Mm-hmm.
can continue to kind of just treat at the same level I'm treating at, provide more. I would love to be able to provide more pro bono work, for people who need it, maybe can't afford it, and maybe more training aspects, and devote my time to. I really enjoy anything to do with junior sports that might
Mm-hmm.
not have the funding, or parents are already paying out the nose for X, Y, and Z, and getting somebody in there to be like, yeah, hey, this is what we can do, running TPI screens for free, and then giving some pointers or whatever that looks like. Um, yeah, and then anybody who needs it, especially some of those more less fortunate groups, you know in town here, like if anybody needs some help, I'm always willing to give it. um I think that's probably it, just
Mm-hmm.
doing the same stuff, but having my money work for me. Well, hopefully own a house, hopefully a little bit of property, maybe some other stuff like that. But again, that's all like financial stuff that's kind of
Mm-hmm.
setting myself up now for that stuff to work for me later. But I think anytime I hear like, oh yeah, in 5 years I'm going to start, going out a little bit more and enjoying life. It's like, man, you, shit can change in a heartbeat. And I've seen that multiple times with people, in my own personal experience as well. And the last thing I want to do, like I really want to try and go to bed each day being like, if I don't wake up, like I've had a pretty good go, you know.
Well, and again, I hate to preach about Gary Keller, but he talks about like financing your lifestyle, right? Not work
Yeah.
and then do something else. Like you should create unearned income, passive revenue streams to, if you want to do what you're doing, you don't have to do what you do to keep making
That's right.
money. So then you do have the freedom if, you want to go do something else, or you break a leg or an arm mountain biking, that it's not like, holy shit, what do I do now? But
Yep.
also that kind of brings it full circle, right? You're leading from the front, that you're not this like, I'm going to, if you were just in the clinic, even if you're this awesome clinician spouting all this awesome knowledge and you're just like, work, 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 save my money, not doing, whatever. And then you're telling people like, hey, my goal is to get you back out and like hit the trail this weekend or go back out hunting, and you're not doing that stuff yourself. Like it's pretty hypocritical, right? Even if you're the
Totally.
best in the world. So I think everybody hits a happy medium on that. And obviously there's outliers both directions there. But I think that's a good way to kind of tie this up in a bow is, like our goal as clinicians is to help the patient achieve their goal. And we
Totally.
can't sit on the sidelines of life and be like doling out really what it comes down to a lot of times life advice on how to do things. And we're just sitting here like trying to make money like that.
Yeah.
I think that's
I think,
I think that existed for a long time in our profession, right? For
yeah.
sure. And we're definitely seeing like the currency of wealth changing, right? We're like, man, you need a lifestyle that you like, not one that you're waiting to live. But
Yeah.
you guys are in Canada, so you're way more freaking laissez-faire than us US. We're all Gary V, go, go, go. I got to buy the jets. So,
Yeah. Yeah.
um, any like last piece of advice or sage wisdom, what you got, man?
Yeah. I think, yeah, I think that's kind of, you kind of hit the nail on the head a little bit there. I think for future grads coming out, I think less less worry about less worry about filling your schedule, more emphasis on becoming a member of your community and being happy with what you're doing will lead to faster success in the clinic. You know, because I know that's a big thing. You just spent 200K on an education. You're, you know, coming out, you're like, holy shit, I got to make money. You've got these, if you're in the US, you've got these, you know, ridiculous student loan payments coming up, you know, so on and so forth. Don't let that drive you to, you know, to sign some contract that you're going to be miserable treating, you know, 100 patients a week for $5,000 a month. Like, I know you got to make money, but at the same time, invest in yourself a little bit, and you won't, you know, finish 3 years of that contract and want to hang yourself. Go work for somebody like yourself who's going to push you to be better. Maybe you're going to make, like, you know, less off the start, but the room to grow is there, and you'll just be a better clinician, a better person, and you won't kind of lose that time of, you know, oh man, I wish those, you know, 6 or 7 years after chiro school, when, you know, are arguably should be some of the better years of your life. You're still, you know, you're probably your mid 20s, late 20s, and you're have a lot of cool stuff ahead of you. Don't get to 50 and be like, oh man, that sucked. Like, I wish I did all this stuff. Live the life you want to live. Don't worry about the finances. They should play out in the wash. Don't be an idiot with your money, but you know, enjoy the experiences, and the rest will follow, because you'll just be a happier person. Like, you know, you can't be in a relationship with somebody if you're not happy yourself. I'd say the same thing is true for business, right? Unless you're just sitting behind a computer kind of analyzing data and you don't have any patient interaction. But when you have patient interaction, 30 clinical hours a week, 60 patients a week, whatever you're treating, you know, and you're not happy and present with what you're doing, and you yourself, it there's only a certain amount of time I think you can make that happen, unless you're a complete sociopath. So
I 100% agree, because you give a lot of yourself away in patient interaction. So you got to be able to refill that tank, you know, doing
huge,
things,
man.
mentality. But I think the point to drive home is great advice for students on what you just said, but also like general advice. Like, the plan doesn't work anymore to outwork your health and then think you can get it back. I think we're wising up to that like, oh, this idea, like retirement doesn't exist anymore. Your health should be priority. And then actually, if you prioritize that health, you're probably going to do things better over the longer term, right? The endurance of life is, I guess, more robust, instead of thinking like, I'm going to bust my ass for 20 years, make a bunch of money, retire. And then what are you going to do? That's why
Yeah.
I kind of wanted to pose that question to you. You're like, hopefully the same stuff, right?
Yeah.
There's a lot that we could dive into on people that are like, dude, I wish I wasn't doing what I was doing today. I get that happens, but like, I think you hit a lot of stuff right there of like, be a happy person first, or a fulfilled person, you know, prioritize what you got to, be common sense. We won't use the word smart, but
Yeah.
ton of great stuff there, man.
I think also too, like, it's weird, right? Because if you're kind of living in this world of kind of I battle between the like, does this suck? Or do I just got to work a little harder for a little bit and it's going to get better? And I feel like maybe some of today's generation doesn't have enough of that grit to work through it. And I feel like kind of the boomer generation had way too much.
It's a really good point.
Deal with it. You know,
Yeah.
like, you know, it's one of these things that there's probably some sort of happy medium you take from that. And I think if you can figure that out, you know, if it sucks for more than, you know, a few years, like, it probably sucks and you probably need an exit stage left, you know. But if it's like, you know, if you just dig deep and kind of battle for a few months, and then, you know, the light's on the other side. The other thing, you manifest that stuff yourself with processes in place, people around you. Like, I have friends that will be like, dude, that's a terrible thing you're doing because it makes you miserable and you've been doing it for a year now. And I'm just like, yeah, you know, drinking apple cider vinegar in the morning is fucking useless. like whatever it might be. It could be small or it could be really major. It could be a relationship. It could be work. It could be apple cider vinegar. Who knows, man?
Yeah, I got rid of that shit years ago.
Years ago.
But that is a great point to wrap this up, because that gets back to what you said was kind of your superpower, right? That you create a plan for a patient. And if you can see where something's going, you can withstand the suck. But if you can't create a plan, or no plan ever exists, like you got to learn to pull the plug on whatever that is, job, health, activity, whatever. So that's a really good way to wrap that stuff up. Well, I appreciate being on here for the second time, man. And
Dude, absolutely.
I'll put out as much or as little contact info as you want. I'll link to some of the other cool stuff you've done. I know. Do you have another documentary coming out soon?
Yeah. The trailer for it just came out yesterday. It's called The Wind and the Wolves. It's a story of my kind of a video after my first mule deer hunt. That was a pretty cool time. A lot of weather elements, and I think they did an unbelievable job on capturing the challenge that it was. It comes out Feb 26th, though. It's a full-length kind of documentary. I think it's just over 40 minutes long or something like that. Nice. So that'll be on Journal of Mountain Hunting and YouTube page, and my podcast, Beyond the Kill. My segment's called Quick and Dirty with Wardo. That's all on YouTube and iTunes as well. So I'm going to probably try and pull you onto that here in the not so distant future as well, so we can kind of trade some services. I'll probably not fuck up the recording, but that's okay. I'll just hang that over your head for a while.
Hey, novice mindset right here. Even though I've been doing a podcast for like a decade, I still got to figure this stuff out. So,
nice, man.
Love to be on there at some point, and make sure it's just later in the evening so we can have some bourbon on that one. But
that's exactly right.
Yeah, I really appreciate you being on, man. I'll link out to all this stuff. If you guys have questions for Matt, you can always hit him up. Whatever that is, how to be as polite as you can be. He's coming out with a book, self-published. So see you next time, Matt. Thanks, man.
Thanks, brother. Appreciate your time, man. Cheers.
Yep.